is going to be recorded from this point onwards, just for folks to know. And good morning and good afternoon, good evening to everybody. It's good to see people from like different walks of my life and also just to see people here. My name is Akhila, as Jehan said. I'm a creative arts therapist working at a hospital here in New York City. It is 6:30 in the morning right now. And I'm also a researcher with a keen interest in studying theater engagement as a kind of health behavior. So that's going to be the crux of our conversation today. But because many of us, I hope, are coming from the space of theater, I just love to call us into this conversation. If you identify as a theater practitioner, a creative person, any kind of artist, if you feel comfortable, put your camera on and just say hello to us, or just make a thumbs up on the chat so we know how many creatives are here in the house with us. All right. Okay, if you identify as a care worker of any kind, somebody who is a clinician, somebody who identifies as being in the health profession, same thing, put your videos on, wave your hand or put an emoji on the chat so we know how many care workers are here with us in the room from this space. Okay. All right, I'm just gonna scroll through my Zoom window so I see all the folks. Hello. Okay, now my favorite question. If you identify as both a creative person and a care worker of some kind, this is your definition of being creative and caring at the same time. You know, maybe move both your hands up, warm up your body a little bit wherever you are. And drop a fire emoji if you're both. Yes, does self-care count? It does. It does. So we're going to, this kind of interaction that we're having right now, hope that this thread continues in our conversation. And also, I hope that this conversation exists on the spectrum of creativity and care and not just limits us in boxes that I'm only this kind of person or that kind of person. And the reason why I'm saying this is because that over the past 2 decades, research into the health effects of theater on audiences, actors, and participants has increased significantly. For today's webinar, we will be defining health, as the WHO says, as a state of complete physical, mental, and social well-being, and not just the absence of disease. We'll also be contextualizing theater, including both performing and viewing theater, as well as engaging in the creative processes of theater making. So, body-based and breath work. The WHO, as Jehan just mentioned, has funded nearly 3,000 and more studies highlighting the significant role of the arts, especially theater, in preventing illnesses, promoting health, and managing and treating diseases across the lifespan. Theater can also inform public health policy and mental health policies globally. And I think that's why this conversation today is extremely important. In this webinar, we'll be hearing from 3 practitioners working across working across projects all over India. And note that these are just some case examples and in no way covers the breadth and diversity of artists and care workers in India who either knowingly or unknowingly are contributing to healthier communities. So this is just a glimpse. By the end of this session, we hope to connect with more practitioners and strengthen the evidence base for arts and health in the Global South and particularly in India. Our session will begin with each speaker discussing the role of theater in their kind of health work. And then it'll be followed by a moderated discussion on how these interactions of theater and health can advance both fields, not just theater and not just healthcare, but really advance both fields in India. We'll conclude with an open Q&A, which is where you guys will step in. So please stay on mute until then. But along the way, I invite you guys to write, draw, doodle, move in response to whatever is coming up for you. Yeah. Okay. So if you're ready, I'd love to hand over the mic to Maitri to introduce herself and her work in Bangalore, and then we'll go about introducing folks. Welcome.
Thank you so much, Akhila, for inviting me to be here. And thank you so much, everyone who organizes this and has organized this for now 5 seasons. just want to, I'm really excited to be here, and I'm also really excited to be sharing a panel with Dr. Mangla and Dr. Tanya. Just to start off by saying I am not a medical doctor, so I think the doctor tag on the poster may have misrepresented slightly the doctors there because I have a PhD. But as my bio says, I'm a counseling psychologist and a drama therapist. And I came into this work through community theater. And it's something that I have felt a lot of love and joy and passion about, working in community settings and using theater as a means to express ourselves, to grapple with something that is real for all of us. And I think in that process, before I ended up studying drama therapy, I noticed that, and I think this might be true for many of us who've done community-based arts work, that things were spontaneously emerging. People were talking about challenges that they were facing, even things like violence, trauma, abuse, but also political things. Also, they were articulating philosophical questions. So a lot of really powerful things were happening. And I felt inspired, but also slightly ill-equipped, particularly around the trauma piece, which is why I was able to study drama therapy. And that was about 15 years ago now. So for the last 15 years as a drama therapist in Bangalore, my work has followed kind of two trajectories. One part of it is in the frame of psychotherapy through Parivartan Counseling Center. I've worked there for 15 years part-time, and I've been seeing individual clients as they get referred to me. More and more, particularly over the last 7 to 8 years, there have been referrals from psychiatrists. So there have been people who've come with diagnosed mental illness, and there I've worked in consultation and tandem with psychiatrists, with clinical psychologists as well. A lot of the work I've worked with children, adolescents, as well as adults. And I think trauma has been an emerging and sort of keeps coming back, particularly sexual trauma. And that prompted me to kind of look at the residues of childhood sexual abuse. And can theater be a way to work through those residues? And that was what I did as part of my doctoral work. So all of this was really interesting, but the other piece, which I think also has my heart, has been working in community settings. So I continued to do that for the last 15 years. I've worked with government schools as well as with NGOs, collectives, unions, and so on. And there they would invite me not because there was a mental illness, but because the community was dealing with something. Something had occurred, or there was an issue that had come up, or the young people in the community were going through something particular, and they felt like a process space would be helpful, and they felt like an arts-based process space would be less stigmatizing. And that was therefore the work that developed in that space. Through that, I managed to meet incredible practitioners, and a few of us came together last year and started the Foundation for Arts and Health India, or FAHI. And that was really because we felt like there was incredible need and incredible scope for this intersection of the arts and health. There was limitations with the sort of individualized model of healthcare. And we didn't have many institutional support spaces. So we said, you know what, let's make one. And let's offer ourselves some foundation space through which we can build collaborations with other organizations that are doing fabulous work. But also we can consciously expand our own notions of both health and the arts. So that is it. That's our motivation to do this work. And we really hope for the arts to be an accessible and effective health resource for communities and individuals. And so that's a bit about how, the context in which I work.
Thank you, Maitri. And I really interested in the part about the having institutional support for this work and not just it kind of being in individual corners. And I was going to invite Tanya to share a little bit about how you are working in your space.
Sure. Thank you so much. Maitri, if I could also remove the doctor from my name, I think that would be great. It's good to unlearn some of these things. So I'm a medical doctor by training. I've done my community medicine. I'm basically trained to be a doctor in a low and limited resource setting. And I've been working with an indigenous people called the Solika Adivasi people in South Karnataka in South India for over a decade now. My work in community health, especially working with indigenous communities, has been more about unlearning what my medical school taught me and learning from the community in what health actually means, what access to health services actually means, what the relationship is like between a physician, not just the patient, but patient's family, caregivers, their expectations, how to handle it, tackle it, etc. Now, most of the time when we're working in, when I've been working in this space, a lot of the focus always has somehow in our conversations in public health is always viewing indigenous communities as, in a negative frame. Deprived, disadvantaged, neglected. In India, any research or any conversation on health of indigenous people is about, higher mortality, malnutrition. Somehow, all the framing, all the conversations that we have are always about something, something that is so stark, something that is so dark, almost where people who visit, who come, who view, are like, how are people even, how are they even surviving, and why are you working in such circumstances? But anyone who has actually visited, and me included, the space here is so full of joy, humor, stories, culture. I mean, I've sort of gotten like, I've relocated, and well, I would like to say that I've sort of moved into this space, or I've been adopted into this space completely. But somehow our conversations in health never do justice to the way the indigenous people view their own health, the way they view its connection, deep connections with the forests and the environments in which they space, the way they view wildlife and the adversities that they face, how they view this as part of that harmony of existence, the give and take that is. And so we have been spending much of our time actually listening and trying to engage conversations, but also struggling on how do we bring this into the formal health conversations that we're doing. But anyway, this community in particular does not, they are a very, there is no script in this community. Historically, there is no visual writing or no visual art form, for example, through which knowledge is shared. So the only way knowledge is passed from generation to generation is by song stories and through visual, like performance, body movements, dances, etc. And both men and women, especially men. It's a very integral part of the raising of a child, of becoming a man, becoming a woman, of relationships, partnerships, etc. But this has always been on the outside. What happened for us during COVID-19 with the lockdowns that came in, we didn't really have much COVID in our spaces because it's all forest. People are anyway relatively isolated, not so much movement outside. But the fear of COVID came. A lot of media reports, a lot of the, you step outside, here's what's going to happen to you. And that really had a tremendous effect, not only on health workers, but also on the people here, because every conversation was it was all about COVID. COVID was in the hospital, so hospitals were viewed as very negative spaces. And in the media, we started seeing a lot of articles coming out about how, the indigenous people are running away into forests. They're afraid of everything. How, words like primitive and ignorant and superstitious started coming up again. And this is really far from the truth for those of you who are not very familiar with India's indigenous people. But this is really far from reality. I mean, these are the kind of conversations that you would read maybe in like documentations of the British doctors about how they used to describe in the, let's say, in the early 20th century about our communities. And so we said there's something really wrong that's happening in the way people are, perceiving and talking about the community and what's happening with COVID. So what we did was we started, there is a Soliga theater, and we were talking about how do we, somehow break this conversation of fear? How do we have a conversation about health, use this as an opportunity to have a conversation about health, but in a positive way, in a way where people come saying, I'm open to a conversation. I want to talk about my health. And that I can make decisions for myself. And that is where, they told us, and they demonstrated to us their local theater forms and the stories. And we started having, different conversations about what kind of messages, how do we frame it, correcting, making sure some, misinformation also shouldn't spread through this. And they came out with a play, and we had like this whole performance piece, which involved teachers, community leaders, everyone come into place. And we went from hamlet to hamlet over 3 months, in some of the most remote forests in this space. And these are, many of the villages don't have electricity, water, etc. And everyone was very skeptical as to whether people will even welcome us, because we're talking about health at the time of COVID. And it was transformative for me, this experience that happened. The crowds were full of women, and people weren't just talking, they were arguing back to us. They were telling us about issues of alcoholism, gender violence, women abandoning their duties, men abandoning women. I mean, a lot of social issues cropped up. In many places, there were loud fights and arguments. But in most places, it was very warm. A lot of tea drinking happened, which was very desirable as well. And it's just completely the kind of conversation since then, now with the communities that we talk about. It's like, the whole dynamic has changed. The fundamentals, the assumptions for the last 30 years working with this community, that, as health caregivers we have been making, all that is completely changed. Now it's more a conversation of listening. And the beauty that of this experience for us, which was really, eye-opening, was that so far we have always used theater as a tool by which we disseminate what we have to say, not really a way of listening, not a way of learning and engaging. And this completely changed that. So now we try and collaborate with the local theater artists. I think there is a lot more drama that happens behind the scenes before, we're arguing over how do we do this. And that process is very insightful and learning for the researchers on my team, for the health workers, because that is how we learn the problems if you frame something in a different way. So anyway, so that's how I stumbled onto theater. And community theater, I've read so many case studies about how it's a social tool, really for us, and especially with this community. It is something like they taught us. They have done this their whole lives, through generations, and so I think we have now learned about how to collaborate and how to work together and move ahead. So that's how I've stumbled onto this space. And thank you so much for the opportunity for coming here. And I hope to learn more from all of you in these conversations. So maybe next time I also want to have some fire, in my screen, if that's all right. Thank you so much.
Thank you. Thanks, Tanya. And I just want to kind of again emphasize the beautiful point that you just made, that theater is not a tool that's coming from the outside to change, but really it's a way to engage in listening, and to engage in understanding the innate strengths already visible in a community, and also to provide agency to folks to tell their stories rather than me coming in to tell you what to do. And I think that is in itself a health outcome. Like when we're working clinically, we look at agency, and we really look at, like lowering people's distress tolerance by understanding their strengths. And theater beautifully in its frame does that. So it's not necessarily like a pill or a medication that's coming in, but the art form is in itself a creative dose, as one might say. So Mangala, I know that you similarly with the like Pieces projects has done community-driven work in Chennai. So I'm curious to hear from your perspective a little bit about the theater and health
Okay.
crossovers.
Thank you very much, Akhila. And I feel extremely honored to share this space with Maitri and Tanya. Very inspiring work both of you have been doing, and definitely we would like to connect with you. Uh, yeah, and talking about our work at SCARF, uh, for people who are not aware, SCARF is a 4-decade-old non-governmental organization. SCARF stands for Schizophrenia Research Foundation, and it has been working towards the psychosocial rehabilitation of people with lived experiences of serious mental illnesses in this part of the country, and probably one of the first institutions to have this kind of a facility in Southeast Asia. So, right from its inception, awareness has been an integral part of SCARF's mottos, but then uh, theater was not necessarily always there. So, we did use street theater more as a added methodology to create awareness, more it can be more informative, to convey a message about how serious mental illness like schizophrenia is treatable, and dispelling myths about the condition. So street theater was probably the only format we were using earlier. But then when Pieces happened 4 years back, for us, Pieces is a project that is funded by the NIHR, and it is the project involves to improve community-based mental health interventions in India and Pakistan. And the focus is using a app-based intervention called Dialogue Plus to see how it can be used to improve mental well-being of people with serious mental illnesses in the community. And what is more important about this is the use of theater of the oppressed as a methodology to engage with these communities, and also involve service users as the lead participants in all these interventions. So there was a lot of unlearning for us that happened in the very beginning. I think we started, we had to unlearn to view people with lived experiences as people who have their own rights and merits, which we probably as clinicians have been failing to notice or acknowledge, because we have been only looking at it, looking to treat them for their problems. So I think that was it was a major start, and most of us started understanding how that can bring about a change in the way we look at people, the way we relate with them. And then theater came in actually. And when we started using the theater of the oppressed to address communities, it slowly evolved. Initially we had a theater team where we had theater performer, professional theater artists, and we had mental health professionals who were interested in theater and were willing to get trained in TO. And then we started introducing service users to the concept of TO. And gradually, we now have a team of about 25 to 30 service users who are part of our theater team. And they are capable of performing a play on their own without any of us being part of it. And which is what they do on a regular basis in our OPD, in the waiting hall, where they choose themes which are generally not brought up for discussion in a consultant's room. Because where the focus is more about medication, side effects, adherence, and whatnot, and or hospitalization and discharge. But here, other aspects, the psychosocial components of having friends, uh, having a independence, their autonomy, their social relationships with people, or the way they are treated in their families, everything comes for a discussion across the people who are gathered in the waiting hall, which started lending a voice to all those service users. And they were able to develop the plays themselves, and they are now performing at very short notice. Like, I think most of us are aware that TiVo is not scripted. It gets scripted on the way. So it is just a short rehearsal about what the scene should be, and then people go on stage and start performing. And many people are able to come forward and participate, in the play during the interaction, which shows that nobody really needs to be great actors to participate in theater, which is one of the biggest learnings that we have. And the same theater has been used in in other areas as well. We work with corporates where we talk to them about mental health in the workplace. And it is not just that, we also go out into the communities, into public spaces, like uh, a bus station, a bus terminus, or a mall, or it can be a public park, where we do have a mixture of TiVo and street theater, more to get the a crowd, to remain in the audience. And it really works. So, and more than anything, I think the service users who have been part of the theater group are the ones who have benefited most. I think we can talk more about it in the discussion. Thank you, Akhila.
Uh, Thank you, all of you. And I already see Jahan has excitedly added questions onto the chat, and we'll get to that in a bit. But I just kind of want to, I want to appreciate the diversity of experiences that we have here with us. From Maitri, with your work with using theater with people who, like, with the residues of sexual trauma, and Tanya, with your experience with working theater, not from a deficit-based model, but really kind of using it as a health promotion tool around COVID-19 with the Solega community. And then, Mangala, with you, honestly using theater through an app-based way to almost give psychoeducation about psychosis, which can be otherwise such a shameful, it can be, has so much shame and stigma attached to it, but really using theater to, talk about the unspeakable and make it almost, I love the idea of the waiting room theater, in a time in the waiting room when people are stressed, when there are conversations that need to be had about treatment, treatment adherence and medication management, and using theater in that space to really talk about stuff which is otherwise so hard to dialogue about. I think all really emphasizes the power of the arts. And I know Dave is saying that also curious about theater in the waiting room. So let's deep dive a little bit into each of these aspects that you've already touched about, all three of you. But my question is, if you can give language to some of the health outcomes as a result of the work that you have witnessed. And this doesn't have to necessarily be in medical language, but just as practitioners, what are some of the health outcomes that you have seen as a result of these theater-based engagements that you have done in your work? And anyone can kind of take the floor.
Yeah, so I don't mind going first. So when we talk about outcomes, I think I would like to look at it as in two ways. One, it is the mental wellness that people who have been part of the theater team have experienced and have communicated. The other one is the positive impact it has had on the people around. So when I talk about the mental wellness, people who have been part of the theater, we know they all come with their own challenges and difficulties, whether it is handling their psychopathology, their delusions or hallucinations, or social anxiety, their difficulty in interpersonal communications. We have, though we don't have an evidence base to say that that is documented, we are seeing over the period of probably 18 months now that there are people who have shown tremendous change in the way they are able to handle their psychopathology. There are people who say that engaging in theater gives them better ways of coping with their delusions or hallucinations. They no longer look at it as a challenge that cannot be overcome. And people with major anxiety issues, especially social anxiety, are now able to come forward and take on the lead roles and perform in the plays. And the self-esteem in general of all these people has gone up really well. They come across as more confident, and they are able to feel that they are valued. They feel that their dignity is now, they are given their due dignity. And the hierarchy between mental health professionals and the rest of the the service users and the mental health professionals has definitely flattened a lot. So people are able to relate better with each other. It need not always be, differential in the way they communicate with a mental health professional, whether it's a social worker or a doctor or a psychologist. I think that is going a long way in bringing about some kind of attitudinal changes in mental health professionals too. We have learned to treat them probably that I think in India there is a very matriarchal or a patriarchal attitude. No, the doctor patient relationship is always like that. We tend to take decisions on behalf of patients and families most of the time. But I think all that is definitely come down. That is a very meaningful discussion about many issues that they are affected with, and they are able to stand up for themselves, talk about things that are not okay for them. They're able to ask for things that they feel that they need. And these are some of the things that we see in people who have been part of the theater team. And of course, it's a small number, but we definitely believe this can be extended into the community if we are going to practice it more. And talking about theater groups and others, volunteers who are part of our theater team, when they are co-creators, when they co-create plays with the service users, we have definitely noticed that their attitudes towards people with lived experience has changed tremendously, especially when they notice that they are able to rehearse lines, they're able to remember, recall, and act or emote better than professional actors. I think it definitely brings a lot of respect for them. And we also have noticed that the non-service users in the group tend to become more careful when they talk about mental health or related issues. There are no loose comments, and the choice of words becomes more careful. And we believe that this definitely carries into their other performances as well. They are more careful about their depictions about mental health in their other plays as well. So I think these are some of the outcomes that I would be very proud of from the theater.
I really, yeah, I'm seeing Sumit if you're agreeing with something, if you like something, maybe there's a sign that, the audiences can make in the essence of theater. I really enjoyed one thing that you said, Mangala, which was that in the medical system, the power hierarchies are so delineated between doctor and patient. And when you introduce theater, it somehow in its format and frame equalizes a little bit of that power. And Maitri, I hope you don't mind me. I'm going to just ask this one particular question to you because I'm just curious. These things about power hierarchies becoming delineated or this kind of community forming and social cohesion forming, how do you, in your research work with Fahi, how do you kind of word it when it comes to, of course, there's one work that's happening with the communities, but then there's also work that needs to kind of like the communication that needs to happen with people who are funders or people who are giving us grants to do this work. How do you translate the health outcomes that you're witnessing on ground? And maybe this is for both you and Tanya. And how do you translate that, or not even, or do we even need to do that when it comes to communicating that to folks who can give us money?
You've put me on the spot. I feel like this is a slightly out of syllabus question, but I think actually, to be honest, I don't think we figured that out yet. I think with funders, it is very, very complicated. I think this is a big challenge. The obsession with outcomes is something that, and this very limited notion of what an outcome can be, is an enormous challenge for us. Because we would like to work longer term, we would like to work longitudinally. Some of these very real questions that are in the chat also is you're building partnerships with communities, right? And you want to be able to build that language together. You want to be able to listen, and all of this takes time. And it's not something that you can go in and many types of, like, for example, CSR funding works on an annual cycle. It's very hard to show things that happen in an annual cycle. So the languaging of this with funders is incredibly challenging. Having said that, I think we are having some shift with philanthropic funding in the country, where there is a little bit more openness now happening towards really being able to co-create with participants, with sort of the different stakeholders, to be able to define together what might a helpful outcome be. And I think for me, that's really exciting, right? So what would be, for this community, what would be helpful? What would be what would be progress? What would be nice if it happened 1 year later? And even if it's that's from a feeling sense or a relational sense, or sort of defining that together. And again, theater is a great tool to define those goals together. So even together to begin to co-create, to be co-researchers, right? And to be able to do that kind of co-produce research together, to come together and say, okay, these are the questions. Because I think sometimes I know that when I'm not an insider facilitator, it's not my own community that I'm working with, or I'm not embedded, I tend to come with a certain type of questions that come from a certain gaze, certain background, certain social location. And I think to be able to hold that aside and put that aside and see how we can together generate questions and generate goals, and then from that generate possible outcomes that we work towards. And then translation of that outcomes into medical language or into social sector language and all can be done. Those are a little bit of translation work. But I hope that to some extent address that. I don't have a very clear-cut answer yet. We're figuring it out.
Yeah, I'd like to add, I mean, Maitri, everything that she said, I think was it's the same struggle, I think, for us as well. Working with this community, I think the focus on outcomes is so much about numbers, especially in a population dense space like our country. 100 means literally nothing. It has to be 10,000s. You need sample sizes in those spaces to be even considered as but I'd like to answer the question you said, but from a different way. I think if you look at sustainability in terms of the community that we're engaging with, like for us, the indigenous people that we're engaging with, this experience of ours, yes, we're still struggling with funding, but the community now is much more open. And I'm saying the word community very loosely, right? But essentially we have, I mean, even though we're in one region, there are 4 forests. There's a lot of differences between people living in forests, those who have relocated, those who have migrated, and then younger generations who've had a particular type of education and older generations. But essentially, this experience was something that really brought together different kinds of people to the same platform, which we've never seen in any conversation. If you're having a conversation on maternal health, then there's a very particular audience there. If you're talking about babies, it's a very particular audience. If you're talking about forest rights, then it's a very particular audience. And so this really helped people coming together. And what was really fantastic was they started having conversations with each other. And I think that kind of method in terms of how do we learn, how do we gain knowledge, how do we have insights, how do we learn from this process, we recognize the potential of this becoming a way of research itself, which I think is quite fantastic. Instead of your traditional focus group discussions where you choose who will come and all the different categories and you analyze. Here, there are conversations, arguments, validations happening in the same space, which is quite fantastic. And the power dynamic that they spoke about, I think the community now is, many different members of the community, many different many different groups in the community now are more, are coming forward saying, can we do more this kind of work? You have women coming saying, can we do something on alcoholism, but let's not involve the men, because they will always try to shut it down. Can this be women led? Can we have only women theater artists script, and it'll be our perspective and we will put it on display? And so you have a lot of I think today we are getting much more ideas and much more conversations that are coming from there. And also the beauty of this space is that what Mangala said, the health workers, the people who are in our team, when we sit and we go through this kind of an experience together with our community members, the way, it breaks these misconceptions in your head, the way it has that equalizer effect on the openness that we are sitting at different sides of the table. But tomorrow I can be there and you can be here. I think these kind of outcomes that we have seen, very tough to, frame it into something quantitative and frame it into an impact on health. So for our space, I think what we recognize is that we're probably a couple of decades away before I can say that we've had an impact on someone's health. But what we're seeing in the immediate is the way they are viewing health services, the way they are accessing health services, the way they are perceiving health workers, the way they see medical information as not something magical and mystical that only doctors know, but something that we can speak about, and everything can be explained, everything we can have a dialogue with. I think those are the kind of impacts and outcomes that we're seeing more and more in the immediate. And so even in future work, when we look at how do we monitor, how do we, how do we make sure we're moving ahead? These are the kind of outcomes and outputs that we would be looking at. Yeah, thanks, Akhila.
Thank you. I mean, clear. Maitri, you had a thought on your
Yes,
list.
just wanted to really, this last point that Tanya said is how you're viewing your relationship to a type of knowledge, right? That shifting is such a profound thing, particularly in our country with the kind of social hierarchies and the kind of the ways in which knowledge has been that held as people have been excluded from knowledge creation, right? And in so many ways, we continue to do this because of our hierarchies of caste and also colonialism. So I think it's radical work to say that I own this knowledge. I'm a knowledge producer. What I say, the way I say it is profoundly important. And I think that shift is something that I've seen even in clinical practice, is my relationship to myself, my relationship to illness or to health or whatever, and to also be able to see myself. I think what drama has offered is as a creative and generative being, as that I can, that I'm not, illness saturated or, so I think that's really a profoundly, and that shift is, and something has to shift also with the facilitator in that process. You no longer are the sole holder of anything. You maybe have some methodological expertise, but certainly subject matter expertise rests clearly with the group. And that comes out very clearly, right? Because it just doesn't work in any other way.
It's what I noticed is that in this conversation that just now happened, we've almost reframed new definitions of health. So Tanya, I loved your definition of reframing health as sustainability of the community, that being a version of health. And Maitri, you just so beautifully articulated theater as something that is creative and generative. And if we can really begin to look at these two subject matters that we're talking about with new light, I think it can, and also I'm just dropping a link here because I think it really illuminates what you, Maitri, and And Tanya just said, Dr. Vikram Patel has a TED talk where he speaks about the idea of generalists, making care practitioners generalists and not specialists, right? And we see it in the hospital all the time, Mangala. I'm sure you can agree that the minute that the doctor becomes a holder of all the knowledge, even though you're imparting psychoeducation about medication to the service user or the family, at the end of the day, it's the family who's going to be taking care of the patient, and it's not so you've given the knowledge, but what is the sustainability of that? So really empowering like trauma informed work through theater and through the arts as a general body of knowledge that is accessible to everybody and doesn't necessarily need this kind of specialization preciousness that otherwise creates these powers is a very powerful concept. So I just want to thank you all for repeating that. And
If I can just add something here, Akhila, uh, knowledge need not necessarily always translate to awareness. Knowledge is something that we can give, but it doesn't make people more aware, nor does it bring about any change in attitude. So I think for that way, rather than other methodologies, theater works much better when we are looking at improving attitudes and making people really aware of what is happening, especially in a field like mental health.
Thank you all. And I'm also seeing a lot of questions on the chat. So we're going to transition to the audience participation section. So Dr. Radha, you had your hand up, and I'm wondering if you have.
Hi, hi. Yeah, thank you, Akhila. Yeah, and I also feel like a bit of an interloper when I use that. You use the title. I don't know. Yeah. Okay. So I just want to quickly point out that all of us here talking about communities are talking from essentially an outsider perspective, right? And the way that we use the word communities has always bothered us at CCDC. We keep pointing that out in our workshops and in our trainings, that there's something slightly problematic there. We always talk of communities as being out there, and so the essential problem there, or the dilemma that I think Dr. Tanya was talking about, is you're not embedded, but you deeply care. And there's always this question of not only the tussle between knowledge, two different kinds of knowledges, right? The knowledge that we take in, which is from a more modern understanding of healthcare, etc., and the more traditional knowledge of health and well-being, etc., that is embedded in the community, etc. There are all these conflicts. But I just wanted to say that both Dr. Mangala and Dr. Tanya, I'm very happy to meet here, because we've been working with you without having actually met. So Dr. Mangala spoke about Theatre of the Oppressed, and currently CCDC is collaborating with SCARF on a project where you're taking TO to schools for your suicide awareness project. So this whole idea that everyone in school has heard of suicide, has some understanding, some knowledge, etc., etc. So how can a theatre practitioner go and facilitate dialogue to bring out that knowledge, etc. So I'm happy. And recently we did a training where Dr. Meena from the Institute of Public Health requested us to allow people from the Soliga community to participate in the training. So while there was a language challenge, uh, we decided to sort of have them, and there was so much learning for us in that. So this addresses both Jahan's question of, how do we not have us being the experts all the time? The reason why CCDC is working with NGOs and training staff is because the work continues, right? CCDC does not go in as the TO experts and work directly with the communities, of whom we have hardly any knowledge, right? So if you have an NGO that is in constant engagement with the community, then the best thing to do really is to train the NGO to keep working with the communities. And the second option is what we did with IPH, which is get people from the Soliga community into our training so that they take back the tools, and the tools now belong to them. And they are already talented. Basaraju and Padma, who had come to the training, already hugely talented people. And we learned so much from them. So I just wanted to put it out there. Yeah, thank you.
And also really exciting to know that this work is again not just in the folks who had been spotlighted, but now we're going to open it up, talking about blurring the boundaries of power. Let's kind of open the audience. I'm just scrolling through the chat, and I'm wondering, Jehan, if you can ask me a question to us.
Oh, I'm so sorry. Can I quickly just something I totally forgot. Dr. Tanya spoke about this not belonging and yet kind of really wanting to, and that's precisely the issue that was addressed in a story that came up in our training. Dr. Meena brought up that issue of going to the community with a project, a funded project which has a scope and a protocol and, this. And the community rejects it because their understanding of maternal health care, which is what that project was about, was so different and much broader in definition than what the project allowed. So, how does one work with these two completely different understandings of a particular project? And then this whole thing of I've been working with this community for so long, and yet there is so much mistrust because I represent, something from outside of the community, and I can never erase that identity. Yeah. Sorry to take up so much time, but thank you for letting me say that.
Incidentally, Radha, that was our first project. That was my first project. Akhila, let me just expand that a bit. It was a WHO Alliance Health Policy Systems Research project on maternal health. And the first thing we said is this is on maternal health. And we argued for 3 hours on what is maternal health? Is it mother's health or is it pregnant woman health? Who is the mother? How do you see a mother? And yeah, it was, that's how we started. Yeah, we've come a long way, but yes, we're still learning. Thank you.
Yeah.
I actually think both your Radha and Tanya, both your points actually addresses Jehan's question, which is, how do you factor in the inherent colonial dynamics of being an outsider facilitator? Like rather than explicitly saying do this or work like this, how do you address that, and how do you kind of cater for the anxiety that is emerging in that difference? How do you name it? How do you call it out? And how do you really listen for the language of care that is already pre-existing? I don't know, Jehan, if you want to speak more to that in the question that you asked.
No, I think between Maitri's earlier response and this, a lot of that got answered. So thanks. My next set of questions really go to the virality and then the scale and the numbers. And if you want to talk about funders, and because you've got three gaps, and I noticed that you all have articulated, including Radha, the gap between you and the community themselves and bridging that, even the idea of coming with the notion of a project, then the gap between you with your funded project, trying to talk to a funder and say numbers, etc. And it's not a challenge we have to shy away from, because I find that a lot that happens with theater practitioners is that they tend to isolate themselves after a while because they can't have that conversation, they can't have that dialogue, especially with funders. And my thing is how does one crack that? And I've been coming up with analogies. And so actually I want to just ask you guys, is this work viral? Can it have a virality to it? Can it catch on like wildfire? Is there conditions for that? Because I think its time has come. And if you look at the analogy of a vaccine, it's a small shot into your system that causes your own body to then create the antibodies required to inoculate you against the current social pandemic, or whatever, And so I do feel like we have a vaccine factory. We have the mechanisms of vaccine making with us, if you look at that social pandemic analogy. But then how do we go on that? And so I'm going to ask you guys about scale. and I'm going to bring it back to numbers because I just pulled this up, that the WHO says that in terms of healthcare, there should be 2.3 healthcare workers per 1,000 population. And if you look at this kind of practice as another kind of socio-emotional or social healthcare or community healthcare, then how many TO practitioners or how many of this kind of healthcare practitioners, theater-based healthcare practitioners, do we need to create a healthy society per capita? And I think that's a number that we should all be banding about and saying, you know what, we need five TO practitioners per 1,000 population. I don't know. Just,
Yeah.
I would love to hear what you guys think when we say, how do you, like Tanya, how do you take your work? And Akhila, was it Akhila who told me, or somebody told me that the largest concentration of, no, it was the lady from the previous Unrehearsed Futures who trained something like 6,000 TO practitioners in Egypt over X number of years. But how do you scale?
Can I, sorry, this is so exciting. And I know that Radha, sorry, would you like to, can I go?
No, go ahead.
And I'm like, yeah. But I think there's two things. One is to speak to your previous question, which is about outside. I think I don't want to assume that it's always an outsider facilitator. One of the work that, one of the pieces of work that we've been doing is trying to identify insider facilitators. It takes more effort. But people exist out there who are able to be good, who have the capacity, who've been doing it, who are arts facilitators, right? And the little bit of bridge between that and being able to do some thematic work is entirely possible. CCDC's training is 6 days long. It's accessible, right? What we've started doing with our previous project is to have to do that effort of finding insider facilitators, to have people shadow insider facilitators, so that at any given point you're growing the number of facilitators organically through an apprenticeship model, without even formal training. We're trying to say, okay, how do we pair up people that might have necessary formal training and people that might not have necessarily formal training so that they can learn from one another? There's some really exciting fellowship programs that are super short and super low cost right now that people are able to quickly gain some skills. There's this really wonderful thing in Myanmar called the Academy of Care, which is a 2.5-month training program for people from remote areas to be able to, in conflict areas, quickly be able to use the arts in care practice. So I'm saying there's revolutionary ways in which people are addressing this important need of how does this get everywhere that it needs to get, and how are people able to hold this work. And the other piece that's very exciting that you spoke about from this vaccine kind of analogy is we've noticed that, for example, even if you're working with 25 children in a government school, there is a contagion effect. You're working with the 25, but slowly those 25 are doing performances, the way they are talking about things changes, they start facilitating processes. It starts to become a counter socializer space within that school. So a lot of funders, that idea that, you might be working with 25 intensively, but the beneficiaries are that community. I think that bit is also really important to recognize.
Yeah, I'd really like to respond to Jehan's thing about virality. Yeah, theater is not that viral. It's not like TikTok, etc. But we have discovered a way that theater productions can fund itself and continue. In Calcutta, we developed for interactive theater of the oppressed, a paid forward feature. That means the production happens, it's free, but if the people who participated want more people to see it, then they pay it forward. and we just tell them that, this was the cost of what it costs. If you want more people, then please put in. If you want people who cannot pay for it, please put in double. Okay. So then what happens is that money is what we use to do it in productions where do the production in places where people would not be able to pay. But we find that by making it paid forward, the theatre designer has to design it in such a way that it is engaging and that people want to pay it forward. Okay. So it's a slow form of virality, but yes, it's one way out.
I think if people from the community are co-creators in the project, then I think it is likely to get a little more better sustained in the community, and it can continue for a little longer because their role, they can take ownership of the project, even if it is going to funding comes to an end. So I think it is engaging them right from the very beginning as co-applicants or co-creators of a project might pave way for things to sustain in the community. Just my 2 pence.
And, if I may continue, Mangal, that is true. But even when you have trained theatre of the oppressed facilitators, they need to earn a certain amount of money, an honorarium, etc. So what we try and do is to back it in a manner that even that can get funded from the audience itself. Okay. And by the way, I've made this offer, and this is not just for people who are in India. The Red Curtain is very happy to back any such initiative, which will, all we need is a scripting idea that this is how we're going to deal with the mental wellness issue. And we'd be very happy to evolve a way that it can be produced on a paid forward basis anywhere in the world. I don't know how many of you know that in Bangalore, we're currently producing, a lot of you are from Bangalore. Have you heard of a production called Anthill? So Anthill has already happened in Rangashankara and Medai, etc. But it's an entertaining musical about mental wellness. Okay.
This is becoming an open brainstorm. So Radha, take it over.
Oh, hi. Yeah. So responding to two things. One, what Maitri said about working in schools and, when you work with children. So that has a flip side to it. So when you work with children, and CCTC does a lot of school work, the children behave very differently, start to behave very differently in their other subject classes, and those teachers complain. And so, and I think Jahan will understand this. Many, many years ago, when we first met, this is how we met, right? Through a school project. And that project was suspended for this reason, that the children were thought to have become disobedient, answering back, etc., etc. So I think we also have to become more than just arts practitioners or theatre practitioners. We also need to be able to dialogue with the system. And I think it's extremely important. That is a skill, and those are strategies that we need to develop. How do you speak to the schools? How do you speak to administrators? How do you address the system? And in the same context, I wanted to say that one of the plays that was created was about this, as I said, this researcher who's going into this community with a project, etc., etc. It was a very moving play. The researcher's struggle came across really strongly, but the audience chose not to engage with that story. They chose another story where the story was very grounded, within a family. It was personal conflicts inside the family. The audience, many from the audience later said that they did not see how this other conflict could be resolved. They did not see a way out of that conflict, of engaging with the community. They saw the researcher as the oppressor and representing a capitalist system, so that is too huge. How does one engage with that? So it's just something to think about, I think. Unless we have solutions to that, we keep offering dialogue as a way to kind of move forward in our understanding of engaging with systems and developing strategies of engaging with systems. I think that has to be an important part of making this go viral, you know.
I'm also wondering about the importance of why are we so scared of things. Like maybe one needs to, or like what is the like this thing of like if you are a researcher and you're coming into this space, how like what is the like what is that auditory anxiety that is originating as a result of that exposure to our communities? And also just having us all like just like reflect on our own because or like each of us very are very different. Tadia, you had your hand up, and I'm also looking for 5 more minutes until this
Sorry.
Q&A.
Yeah. Sorry. I mean, I just wanted to say one thing about, the point of going viral and also on scaling of funding challenges, etc. I mean, one is not everything goes, most things that go viral don't actually deserve to go viral. It's just one of those things there. So, but I do know the temptation of, numbers, having these big points, people coming in saying, yes, we'll come behind you, we want it. And working with Indigenous people on this conversation, there are so many teams I know who have been doing this for decades because there is value in this kind of engagement, not because there is that kind of space or buzz, in the global health space or even in the funding space, etc. So there are, what I would say is that there are many people who have the same struggle, though they may not be it may not be about theater and health, but it may be about something else. But I think finding solidarity across those struggles, there's a huge breakdown in social movements in health in India. Karnataka, for example, all our people's health movements, chapters, all our social spaces have gotten, um, either they have faded away or they have been broken down, and they're continuously being broken down even today by the current government in space there, right? So I think the importance is for this kind of a space, a network where people from different disciplines, but who have that same anguish, who have that same fire, that same motivation, creativity, come together, we express solidarity with each other, we reach out, we network. I mean, Fahi and us also, it's not like we had a project or anything, but it was like, we think we like what you're saying, there's a connection there, we want to work together. So more, I think the pitch now is for more interdisciplinary coming together, for us to step out of our comfort zones and spaces. From what I have heard today here only, I mean, I was telling Akhila, so many different ideas and thoughts and so many different links. Like Radha said, there are so many different people and things that were going on. I think staying away from the number game is best for our own, what do you call it? To not get frustrated with the process, basically. I have seen a lot of people who have been working with Adivasi health. After 10 years, 20 years of the struggle, they burn out or they just switch off and they move to a completely different continent and a completely different life. I mean, I wouldn't wish that for anyone. How do we keep the conversation on? How do we keep our energies going? Funding, yes, there is that shift in spaces. Actually, so I come from a space of health policy and systems research, and there's a lot of people who are very open to methods. The problem is they don't know who they are, they don't know where to look, and they don't know whom to reach out to. The kind of initiative that FAHI is, which is the Foundation of Arts in Health in India, is really like a bridge space, because they connect to us, people in the art space and people in the health space. I think there's a need for more these kind of spaces that bring together people. And we'll find that I have found that I have more like-minded people outside the medical fraternity than inside the medical fraternity. I'm ready to switch, if anyone else will take me as well. But I think it's important to recognize that the number thing and the scaling thing is, I know it sounds like that's the answer, but it's not. There are beautiful programs in public health that have completely shut down merely because someone decided that this works well and have upscaled it without the spirit of it, and that would also do a lot of harm to lose this in that space. So anyway, Jehan, I guess years of working with cynicists and skeptics in my space, I have also, some of that has rubbed off on me. But I think we need more work. I think from what Sumit said, from what Radha said, I think I'm already seeing potential, new conversations emerging. And definitely, I think it's important for us to write more about it. I think there are I don't see enough papers on these kind of concepts and things like that. Yeah. Sorry, Akhila, that's all. I'll stop with that.
Absolutely agree. And what I'm hearing are these two sides of the conversation. One is this idea of the virality of this work, and does this even need to go viral, this kind of theater and health practice? And then the other question that like the other call for action, which is we need more interdisciplinary spaces and kind of not taking away the spirit of this work that's happening more locally. I do have my professor who's here, Dr. Nisha Sajani, who taught me this work in the New York University, and we often grappled with these conversations. So I'm wondering, Nisha, if you wanted to comment on this, on the work so far, because you are involved in research as well. So what does it look like to document this work and live in this tension? Yeah.
I'm just really appreciating being able to listen in on this conversation and being part of it in this role. And I guess there's a few things that I'm really resonating with. These recent comments around what really needs to be scaled, and that part of my work is also with the WHO in a lab that focuses on the arts and health, the Jameel Arts and Health Lab. And the focus of that lab is to measurably improve lives through the arts. And for a while, we would just follow up that sentence with, and scale the impact for those interventions that have good evidence. But no, not everything needs to be scaled. And I know from my own work in public schools in the New Haven, a city in Connecticut, that the work that we would do in elementary, middle, and high schools that was very tailored to the teachers and to the students there, with drama therapists and then with theater facilitators and then with teachers involved, sort of growing outwards from a specialist model to a generalist model, really benefited from the close relationships that we were building. And so when we tried to move out of state, we found that we couldn't very easily, not without losing that precious something that was the heart of the work, which were the relationships, which enabled the trust, which allowed us to do all that we were doing. And of course, we had to think about, well, what is scalable then? Sometimes it's not, should this be scaled or not? It's what element in this is the viral idea? What's the thing that we want to move forward? And, you mentioned Akhila Vikram Patel and his emphasis on putting health back in people's hands. And that's a great idea. And there are many pathways to that, right? So it's not going to be only through theater, and it's not going to be only through VR or through cell phone videos. I know that he's been doing that in some of his initiatives. There's going to be some element, though, that could really take off a bit like seatbelts might, or like any other major public health strategy might. In terms of, there were some comments earlier about the power of, who was it that mentioned this? Mangala, I think it was you that mentioned, the limits of raising awareness and raising knowledge, and that insight doesn't necessarily lead to changes in action. And we need these somatic, visceral, relational kinds of practices. I think you used other words as well that really allow us to rehearse, to practice, to practice being differently. And so just want to lift that up, echo that. Maybe one last thing, which is, Akhila, you and I used to have a lot of conversations about power. And these conversations show up in the chat as well. How do we avoid reproducing dynamics where there's a knower and, the doer and the done to? And I know our conversations had to do sometimes with that. Not all power is bad power. Just because one has power doesn't mean we need to abuse it. So, and that's really critical, because actually it's important to have power. It's important to have it, and important to use it well. And, anyway, I know this crowd knows that, but it's an important nuance, because I think sometimes these conversations can collapse into we need to absolve ourselves of any power that we might have. And I certainly don't see that as the case, but thanks very much, Akhila, for calling on me, and it's great to be here.
Thanks, Nisha. And I also want to say that, if people in this room didn't have power, this conversation wouldn't have happened in the first place. So maybe, how are we each looking at power in our own lives? And maybe that's a beautiful note with which we conclude today's recorded part of the conversation. And now we can move to a more, what Jehan calls the water cooler section, which is, a more relaxed, chilled out, networking opportunity, or just like thoughts and feelings opportunity. I need to leave for work, so I might be stepping out, but it has been such an honor to be connected to home while I'm not at home, to exist in two different places with all of you, and to know that this work is not going to happen alone. All of us in different parts of the world, be it in the US, in Africa, in India, in different parts of the country and the world, we all are doing this work and we're not alone in it. So more power to all of us. Thank you all so much.
A real big thank you to you, Akhila, for
Thank you, Akhila.
such a
Thank you,
lovely conversation.
Akhila. That was amazing. Thank you.
It's just popping today, really popping. And I've seen a number of these conversations. This one is really up there. Thank you so much.
I will reiterate that this conversation, like the link of this conversation will be out online and will be sent to all of you. And there's also going to be a beautiful